Good evening, everyone. I'm Don Postles. More than a dozen people treated at the VA hospital have tested positive for a pair of life-threatening viruses. News 4's Rachel Kingston is live at the hospital tonight with the latest on this health scare. Rachel?
The latest numbers, current as of today, show that 20 veterans who were treated with insulin pens here have tested positive for either hepatitis B or C. Those are viruses that affect the liver and can put patients at increased risk of cirrhosis and liver cancer. Hepatitis has been found in the blood of 20 veterans who were exposed to the reuse of insulin pens at the Buffalo VA hospital between 2010 and 2012. 14 tested positive for hepatitis B, 6 for hepatitis C, according to the VA's Inspector General.
Nobody gets up in the morning wanting to come here and put veterans at risk. And so to our veterans, we absolutely are sorry.
Treatment for hepatitis C generally involves 24 to 48 weeks of therapy. Currently, the therapy requires both injectable and oral medications.
The same pens were used on different patients, a serious violation of medical protocol. But there will never be any way to know for certain if these veterans got hepatitis from the contaminated pens or some other way.
I'm sure the families and the patients involved are going to certainly allege that this was a direct result of the reuse of those pens. So, the taxpayers are at risk here. I wouldn't doubt for a minute there won't be lawsuits.
Congressional leaders were briefed by the Inspector General Thursday. Congressman Brian Higgins called it, quote, alarming, and said it reveals a frightening level of incompetence by VA personnel, a total systemic breakdown. Representative Chris Collins pointed the finger at Secretary of Veterans Affairs Eric Shinseki and the rest of the VA's Washington leadership.
Frankly, I would call on the president. Some heads need to roll here. I believe the secretary should be relieved of his job. I believe the undersecretary should be relieved. You have to clean house at some point in time to bring someone in who says veterans come first.
The Buffalo VA hospital is already working on making some of the changes that the Inspector General has recommended. The hospital says it is conducting further reviews of policies and procedures to ensure inappropriate actions are prevented in the future. By the way, 4 of the veterans who tested positive for hepatitis here have cleared the disease on their own. That is, their bodies have taken care of it. Reporting live from the Buffalo VA hospital, Rachel Kingston, News 4.